I'm going to show you what you can expect to find and what you should look for as you go through the marketplace. I've taken screenshots that will be similar to what you'll see as you're shopping for a plan. And although it's not the most exciting thing I've ever talked about, we decided it's better for you to have a good sense of what you'll see than to talk about it without showing. Feel free to pause and come back to any part you want to see again. And also know that as you're doing your shopping, you can bookmark pages in your browser, you can use your browser history to find pages you visited before, and you can also open a spreadsheet so you can keep track of links to different options that you've come across. Here we go. When I went onto the marketplace and I put in my fictitious family and where we lived, it came up with 25 plans that were available to cover me for our family. And the first screen that you see gives very summary information. Here, for example, I'm looking in Illinois, and the one on top is the Blue Cross and Blue Shield of Illinois Blue Focus Care Bronze 209. And just remember also, these are 2019 plans. This is not a 2020 plan, and I'm not saying that any particular insurer is the right one for you. Also, you don't need to read what I've put up because it's just to give you a sense of what it looks like rather than the content of it. So let's just assume that this first plan is of potential interest to me. I see on the left-hand side that I can press a link for a quick view. So let's press the link, and this is the screen that comes up. Again, it's not a whole ton of information. There's nothing that's going to make me love it or hate it. I want to get some more information. So I'm going to click where it says Summary of Benefits. And then it takes me to the Summary of Benefits, which is a fantastic thing that is required by the Affordable Care Act. And what it means is that you will be able to compare side by side different plans in a way that they match up. So each particular category has to be listed. Certain costs need to be disclosed, and any restrictions also need to be disclosed. Here in particular, we want to look at services related to mental health. So I found this part that says if you need mental health, behavioral health, or substance abuse services, then they list outpatient services and inpatient services. You see that for someone who is a participating provider, you pay 50% of office visits, 40% co-insurance for other outpatient services. And if you don't go to a participating provider, the service is not covered. Also, you're required to get a referral. And then I also put in the part about if you need drugs. This is just to give you a sense of what you'll find in terms of cost and coverage in a way that you can compare one plan to another. I have found that when I have done this exercise for my own family, I end up printing out a few of these summaries of benefits and laying them out on a table and getting a sense of where things line up for what my family might need. Okay, so let's assume that this is of interest to me, this particular plan, but I still have some questions. So what I'm going to do is go and look at the plan or policy document. So I click on the link at the bottom, and it takes me to a website that's got a whole lot of information. The plan is going to tell you everything that it covers, what its exclusions are, and all of that. And if there is a particular medical condition or mental health condition of relevance to your family, then I'd suggest that you look for it and see whether there are any exclusions, what's covered, what's in, whether you have to go to certain places, what kinds of approvals are required. But for the sake of our looking at it, let's just look at some things about mental health. So outpatient office visits, here it's 50% of the provider's charge. Inpatient treatment of mental illness. Well, wait a minute, what do they mean by mental illness? Does that include my loved one? So you can look through and find the definition of mental illness. You can also look at the plan for what the hospital benefits are in case there's a possibility or likelihood of inpatient care needed. Here, for example, the covered services, number of inpatient days, there's no limits, but they also cover partial hospitalization. They also cover intensive outpatient treatment, but you would want to read the fine print to make sure that it's going to cover the things that you want to be covered. And then here's an important thing, hospital limits. Here you see that there's this thing called pre-admission certification, which is basically another kind of prior approval. And there's also concurrent review, that once someone is receiving care in the hospital, then the plan is going to be reviewing that to make sure that it's still what they would call medically appropriate. You may recall from Becky's story that Joe was discharged from the first hospital after just 3 days, and it was because insurance wasn't paying for it anymore. Presumably, they had some level of review that said, or some assumption that 3 days was enough for that particular care, and either the hospital did not seek to have that reviewed and extended, or it was reviewed and denied. We don't know. But just know that these processes happen, and the fate of your loved one could be dependent on that. It also would help you know, so that you know what kinds of advocacy you might want to do. For example, if your loved one was in the hospital and you knew that it was only a 3-day stay, but you believed it needed to be longer, then you'd probably want to seek out the hospital social worker and talk with them and get their support for extending your loved one's stay so that they could receive appropriate care. Another area you might want to look at, especially for people with mental health conditions, but basically people with any kinds of chronic conditions, is to look at the prescription plan. Every plan has what's called a drug list or a formulary. It lists all of the drugs that are covered and also what the copayment is expected to be on it. As you get past the generics, the price generally goes up of your copay or your coinsurance. So you would want to look up the kinds of medications that you know you'll be taking, or your loved one, anyone in your family and on your plan will be taking, and see at what level those are covered. And then finally, you'll also want to look at the limits for the prescriptions. And here you see that it requires prior authorization for certain medications. And also, you need to have step therapy, so that you need to, as I said earlier, try the lower priced generic medications first, and then at some point, they will review your request or your provider's request that you take a certain medication. All right, so that should give you a sense of the kinds of things to look for, where you can look for information, and what kind of information you can expect to get. Now, similar things apply when you're changing plans, but I do want to also raise a couple of things. One is that you really want to avoid having a gap in coverage, so try to get everything lined up before your current plan expires. Also, you may be shut out of getting a plan if you don't act within open enrollment. So we also don't want this to result in a setback in treatment. For example, one of our volunteers knew she was losing her job and then also her health insurance. And so in order to plan ahead, she coordinated with her provider so that she got a 90-day supply of her medications, so that she would not have an interruption in her treatment as she got on new health insurance, as whatever authorizations needed to happen went through the process. So just think ahead, and what can you do so that your loved one does not suffer as you change.